The patient will be advised by both the physiotherapist and the occupational therapist to adhere to the knee precautions for at least 3 months to protect the new knee joint. Your physiotherapist will teach you exercises to help you regain the strength, movement, and function in your new knee. Before you begin, here are some do's and don'ts to protect your new knee joint. Do not squat or kneel for the first 3 months after surgery. Do not participate in vigorous activities until advised by your therapist or doctor. Do not apply heat on your operated knee. It can worsen the pain and swelling. Do not perform deep massage for your leg. Do not change the height of your walking aid without consulting your therapist. Do rest. Allow your knee to heal. Don't overwork your knee. Apply ice on your knee for 20 minutes after each exercise session, up to 3 to 4 times a day. Place a pillow under your ankle when resting to reduce swelling and help straighten your knee. Knee bends. The aim of this exercise is to reduce the stiffness in your knee. Loop a towel under your foot. Using the towel for assistance, bend your knee by sliding the heel towards your buttock as much as you can. Hold it for 10 seconds and then straighten it. Repeat 10 times. 10 seconds.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Very good. Okay, then come down. Repeat this 10 times. Static quads. The aim of this exercise is to straighten your knee and strengthen your thigh muscles. Roll a towel and place it underneath your ankle. Straighten your knee by tightening your thigh muscles as much as possible. Hold it for 10 seconds and then relax.
5,
Repeat 10
6,
times.
7, 8, 9, 10.
Inner range quads. The aim of this exercise is to strengthen your thigh muscles. Place a rolled towel under your knee. Lift your ankle off the bed by straightening your knee and tightening your thigh muscles. Hold for 10 seconds. Slowly lower your leg and relax. Repeat 10 times. Straight leg raise. The aim of this exercise is to strengthen your thigh and knee muscles. Bend your non-operated leg on the bed for support. Straighten your operated knee by tightening your thigh muscles and lift your leg about 20 cm off the bed. Hold for 10 seconds, then slowly lower your leg and rest.
3,
Repeat 10 times.
4, 5, 6, 7, 8, 9, 10.
Stop the exercises if you feel more pain that does not get better with rest. Apply an ice pack as appropriate for swelling and pain relief. Seek advice from your physiotherapist before continuing the exercises. Madam Cecilia, now we'll go for a walk. You can slowly try to stand, put your weight on your hands to help you to support yourself. And then just stand evenly first. Okay, so to walk with the frame, what you need to do first is to move the frame forward 1 foot length, and then the operated leg, and then the non-operated leg. Very good. Yes. Good. You feel okay?
Yeah,
Not giddy, we just check the height of the walking stick. Just make sure that this is at the wrist level. So hold it on the side of your non-operated leg. Move the stick in front slightly, then the operated leg, and then the non-operated leg. operated leg, non-operated leg. Going up and down stairs. When you are going upstairs, step up with your non-operated leg first. Then, move the operated leg and the stick onto the same step. When you are going downstairs, place the stick on the step below. Step down with the operated leg, followed by the non-operated leg.
Hi, good morning, Cecilia.
Hi, good morning.
Hi, my name is Singi. I'm the occupational therapist. As occupational therapists, we look at your day-to-day tasks and how your knee operation might affect your day-to-day tasks. We will teach you some strategies. So to start off, I'll reiterate some precautions we need to take note of. It is a knee replacement. We will not kneel and we will not squat for the next 3 months. To get out of bed, roll to my side, and then I would like you to bring both your legs down. And then sit up, prop up with your 2 hands. Okay. I would suggest you to wear slip-on shoes rather than sandals that will require you to lift your leg or bend forward to secure the back straps. Use a shoehorn if required. You can touch the floor and add pressure to it. That's good. Okay, so now we can slowly make our way to the chair. Avoid sitting on low chairs. I would recommend sitting on stable chairs with backrest as well as armrests that you can push off with your arms. Bring your right foot forward again and lower yourself slowly onto the chair while supporting yourself with your arms. When wearing your pants, start off with your operated leg first. Lower the pants and insert your foot in. Use the armrest or walking frame to support yourself while standing from the chair. Stabilize yourself in a standing position before pulling your pants up past your hips and fasten your pants. When taking off the pants, pull them down past your hips before lowering yourself onto the chair. Pull off from the non-operated leg first, followed by the operated leg.
I can bend.
Yeah, you can bend forward. Okay, so that's how we will wear pants after the knee surgery. This is how you will set up your toilet in your home environment. So in an event that your toilets and your shower room is combined together, please use the toilet bowl to sit down when you shower. You have a separate toilet. I would suggest that you have a sturdy shower chair inside your bathroom for you to shower in sitting. Please also keep the commonly used items within reach, such as your towel, your clothes, the shower head, as well as your toiletries. That's how you will set up your toilet and bathroom at home. To set up your home environment, we will try to place the commonly used items like pot, pans, small cups for tea and coffee that you use every day on the tabletop or somewhere along the first row of drawers. Like this, we have a spoon here. We will try to avoid overhead reaching that is too high up or things that you need to bend down low to take. Because you just had your operation, I also would advise you to have a stable chair, something like this with armrests. If you need to do things on the tabletop like small cooking and you need to stand for a prolonged period of time. Okay, so Cecilia, because of your knee operation, we'll get into the car by being seated first and then swinging both your legs into the car. So you want to try?
one at a time you can swing. Yeah. Okay, so this is how you sit getting into the car. Now we're going to practice getting out of the car. So same thing, one leg at a time. I want you to swing your legs out. And then, yeah. Okay. And then when you're ready, you can stand up. Okay, and then we'll walk.